Good evening. Thank you for joining us. I'm Jessica Blasco. DeMartino Dental Associates in Phillipsburg, New Jersey is now offering a new type of technology called the Veloscope to detect oral cancer.
The doctors and myself here at DeMartino Dental Associates have always felt that we needed to stay on the cutting edge of all the current medical dental technologies that are available today to ensure an extremely thorough visit for the patients, whether it's treatment with the doctors or a preventative maintenance appointments with my hygienist or our hygienist. We feel that we have a responsibility to our patients. For the last 48 years, since 1961, we have had a reputation in the area. I feel that we offer the most comprehensive and highest quality dental care that we possibly can offer our patients.
That's why DeMartino Dental Associates is one of the first in the Lehigh Valley to offer a new technology to detect oral cancer called the Veloscope.
The Veloscope is actually an imaging scope that was developed using a new technology called fluorescence visualization. And what it does is it illuminates the mouth, tongue, the lips, anywhere inside the mouth, towards the back of the throat, that may be an area that we want to examine for oral cancer. We've always done a white light visual exam, in the mouth. This allows us to see deeper down into the tissues, something that we couldn't see with our naked eye.
And while you might think an important procedure like this would be difficult, it's really quite easy.
It's actually a very simple procedure. It adds about 1 to 2 minutes to the dental hygiene appointment. Our hygienists in our offices perform the exam prior to the doctor coming in the room, and if there's anything questionable, we'll take a look at it. But basically, it's a light that is shined into the mouth and illuminates the mouth.
Many people opt out of this simple screening because they believe they're not at risk for oral cancer, but that's not necessarily true.
All adults should have an oral cancer exam done at their dental hygiene appointments. In our office, we've always done as I said, a visual exam with every patient that comes in. I would say at 21 and over, we start at 20, 21. The reason that I say everyone should have it is because oral cancer, unfortunately, has been on the rise, as many cancers in the world today have been. It used to be that a high-risk group was a male drinker, smoker, and that is no longer the case anymore. Everyone can be exposed to it. There has been a strong association to the human papillomavirus, which has been in the news quite a bit lately, especially regarding the vaccine for young girls. There has been a link between oral cancer and HPV virus, and therefore anybody should really be examined.
Oral cancer screenings are just as important as those for other cancers.
Cervical cancer is something that women are screened for regularly. Oral cancer is actually 3 times more prevalent than cervical cancer in the world today. Every hour of every day in America, a person dies of oral cancer.
Thanks to the Veloscope, those with oral cancer have an 80 to 90% survival rate.
We felt that this was a very vital addition to our practice. Tragically, oral cancer is usually detected in very late stages, and 2/3 of the time that could be very bad for the patient. The survival rate is actually only 20% for a 5-year time period after the detection. Reason being is because oral cancer was always, prior to using the Veloscope, detected in a white light visual exam. By the time I can see actually something on the side of a tongue or in the back of the throat in a patient, it's already further down the road, much further down the road than where we want to be.
Saving a life isn't the only reason getting an oral cancer screening is important.
Another critical reason why the detection of oral cancer in its early stages is so important is the much less of an impact on the patient's quality of life. If we detect it early, the removal is going to be much less if something has to be excised or removed from the mouth. In later stages, unfortunately, oral cancer involves a lot of reconstruction of the oral facial cavity, and that could be very disfiguring and really affect a patient's psyche.
Now that you know the dangers of oral cancer and what to do about it, it's time to take action.
People can actually go to our website, which is a pretty thorough dental information website. It's www.demart DeMartinoDental.com. And there's a link on there on the website for Velscope, and there's a lot of information. People can read about it there. If they wanted to make an appointment for an examination, we are located in Phillipsburg, across from Warren Hospital on Roseberry Street.
In Phillipsburg, New Jersey, Jessica Blasco, TV2 News.